The body is starving in a house full of sugar. I want you to forget lab values for just a minute. Forget insulin drips. Forget anion gaps. Let's understand the story first. Imagine this house is your patient's body. Outside the house are mountains of sugar. There is food everywhere, enough to feed the family for weeks. But the front door is locked. The key is insulin. Without insulin, all of that sugar stays outside. Inside the house, the refrigerator is empty. The pantry is empty. Everyone inside is starving. That's exactly what happens in diabetic ketoacidosis. The blood is full of glucose, but the cells can't use it. So the body makes a terrible mistake. It believes it's starving. Everything that happens next begins with that one misunderstanding. Remember this picture. A body starving. Inside a house surrounded by sugar. The whole disease in one picture. Once the body believes it's starving, it switches into survival mode. If it can't burn sugar, it burns fat. Think of fat as emergency backup fuel. It keeps you alive. But it comes with a cost. Burning fat produces ketones. Ketones are acids. As ketones build up, the blood becomes more acidic. At the same time, the unused glucose continues floating through the bloodstream. The kidneys try to remove that extra sugar. Sugar leaves through the urine. Water follows the sugar. Now the patient is losing enormous amounts of fluid. So DKA isn't just one problem. It's really three emergencies happening at once. The cells are starving, the blood is becoming acidic, and the body is drying out. Everything you see later, every symptom and every treatment, comes back to these three problems. Remember starve. I like using words that actually tell the story. Starve. Because that's exactly what the body thinks is happening. S stands for sugar trapped outside the cells. The fuel is available, the cells just can't reach it. T is for thirst. Sugar pulls water into the urine. Patients become incredibly thirsty because they're drying out. A is for acidosis. Burning fat creates acidic ketones. R is for rapid breathing. The lungs try to remove acid by blowing off carbon dioxide. V stands for volume depletion. These patients can lose several liters of fluid before they arrive. And E reminds us about electrolyte shifts, especially potassium. Remember starve, and you'll remember why almost everything in DKA happens. Why are they breathing so fast? One of the first things you'll notice is the breathing. These patients aren't taking little fast, anxious breaths. They're taking deep, powerful, rapid breaths. These are called Kussmaul respirations. Here's my favorite way to picture it. Imagine a chemistry laboratory filling with acidic smoke. The room is becoming dangerous, so someone turns on a giant exhaust fan. The lungs are that exhaust fan. Every deep breath removes carbon dioxide. Carbon dioxide acts like acid inside the body. Less carbon dioxide means less acid. The patient isn't trying to breathe faster, their body is trying to survive. Whenever you see deep, labored breathing in a diabetic patient, don't assume anxiety. Think, the lungs are trying to clean up an acid problem. Why are they so dry? Now let's explain dehydration. Imagine pouring sugar onto your driveway, then spraying it with a garden hose. Where does the water go? It follows the sugar. Your kidneys do the exact same thing. When blood sugar becomes extremely high, glucose spills into the urine. Water follows every bit of glucose. It's called osmotic diuresis. You don't have to memorize the name. Just remember the picture. Sugar drags water with it. Hour after hour. The body loses water. The patient urinates constantly. They become thirsty. Blood pressure may fall. Heart rate climbs. Skin becomes dry. Some patients lose 5, 6, even more liters of fluid before arriving at the emergency department. They're becoming raisins long before they walk through your doors. The labs tell the story. When you look at the laboratory results, don't memorize numbers first. Read the story. I use the word acid. A stands for anion gap. The gap becomes elevated because acids are building inside the bloodstream. C stands for carbon dioxide, or bicarbonate on your chemistry panel. It becomes low because buffering systems are being used up. I stands for increased glucose. The blood is packed with sugar that can't enter the cells. D reminds us of dehydration. You'll often see laboratory evidence that the patient has become volume depleted. Add positive ketones to the picture, and suddenly everything fits. The labs aren't random numbers. They're simply the evidence supporting the story you've already learned. Treatment. Flow. Treatment makes perfect sense once you understand the problem. Remember flow. F is fluids first. Imagine a completely dried out sponge. Before anything else, it needs water. IV fluids begin restoring circulation and improving perfusion. L is look at potassium. Never ignore it. O is open the cells with insulin. Insulin unlocks the door. Sugar finally moves into the starving cells. Once the cells can eat again, they stop burning fat. Ketone production slows. The acid problem begins to improve. Finally, W stands for watch glucose closely. Everything changes during treatment. That's why DKA requires continuous monitoring. You're not treating one disease. You're reversing 3 problems at the same time. Never forget potassium. If there's one lesson I want every new ER nurse to remember, it's potassium. Think of potassium as the electricity that powers the heart. That's why I picture bananas hanging from power lines. Here's the tricky part. Many DKA patients arrive with potassium that looks normal, or even high. But appearances can fool you. The body has actually lost a tremendous amount of potassium through the urine. Once insulin starts working, potassium moves back inside the cells where it belongs. Blood potassium can fall quickly, and low potassium can lead to dangerous heart rhythm problems. That's why potassium must be checked before starting insulin and monitored closely during treatment. Never let a normal potassium fool you. Always think about where the potassium really is. Nursing priorities. DKA isn't something you treat once. It's something you manage continuously. I remember SAFE. S is sugar checks. Glucose changes rapidly. Frequent monitoring guides treatment. A is assess neurologic status. Changes in mental status can signal worsening illness or complications. F is fluids. Make sure they're running as ordered and reassess how your patient is responding. E stands for electrolytes. Potassium, bicarbonate, and the rest of the chemistry panel tell you whether treatment is working safely. Good DKA nursing isn't about memorizing orders. It's about reassessing the patient over and over again. Every hour, you're asking, are we moving back toward normal? Case study. Let's put everything together. A 19-year-old with type 1 diabetes arrives vomiting. They have abdominal pain. Their glucose is 520. Their anion gap is elevated. Ketones are positive. They're taking deep Kussmaul respirations. Instead of jumping straight to insulin, pause. Think through the physiology. First, how dehydrated is this patient? Second, can they protect their airway? Third, what is the potassium level? Can insulin be started safely? Then begin reversing the 3 problems you've learned. Restore volume. Unlock the cells with insulin. Monitor electrolytes closely. Once you understand why the disease happens, the treatment order stops feeling like a checklist. It becomes logical, and logical medicine is easier to remember forever. 3 pictures to remember. As we finish, I don't want you leaving with a list of lab values. I want you leaving with 3 pictures. Picture number 1, the locked house. Sugar is everywhere, but without insulin, the cells are starving. Picture number 2, the giant exhaust fan. The lungs aren't panicking. They're blowing off carbon dioxide to fight acid. Picture number 3, the dry sponge. Before the body can recover, it has to be refilled with fluid. Then insulin finishes the job by opening the cells and stopping fat burning. Remember our 2 memory words. Starve. Sugar trapped outside cells. Thirst. Acidosis. Rapid breathing. Volume depletion. Electrolyte shifts. And remember, flow. Fluids first. Look at potassium. Open the cells with insulin. Watch glucose and electrolytes. One final thought. Don't think of DKA as high blood sugar. Think of it as starvation in the middle of a buffet, acid from burning fat, and dehydration from sugar dragging water out of the body. Every treatment you give is simply reversing one of those 3 problems.